Hi, I'm Dr. Mont Cartwright, founder of Medical Eye Associates and medical director. I'm here to talk to you today about an exciting new addition to our practice. We're going to be talking about floaters, which are those wispy and funny little things that float in front of your eyes and can be an annoyance sometime, for example, when you're trying to read. Now, in the past, I've had to tell patients that we really didn't have any treatment for this, patted them on the back, reassured them, and sent them home. But now we're proud to be able to offer a treatment for these floaters in the way of a specially designed laser that can vaporize various floaters. Now, what are floaters? Floaters are condensations or accumulations of protein in the jelly body, or what we call in medical terms the vitreous inside the eye. The vitreous is a large fluidy jelly compartment that is behind the lens of the eye and basically occupies about 80 to 90% of the eye. Symptoms of floaters are little wispy spider webs, bugs that you can't seem to find that are floating around you, lines, shadows, and they tend to move around when you move your eyes back and forth. They float with you, and that's why we call them floaters. Now, these are diagnosed very simply by listening to the patient's complaint, but we also use our microscope in the office to look into the deep structures of the eye and search for these annoying little protein condensations. Now, in the past, as I mentioned, there was no treatment for these, and in most cases I just had to send the patient home and told him that there's nothing really wrong with your eye, it's a part of getting older, and that this will never hurt you. The only option we had back then was a very, very invasive surgery called a vitrectomy. And the risks of that surgery basically outweighed the benefits of that surgery, so it really wasn't a good option for patients. Now, however, we have a specially designed YAG laser, which we use for other types of eye disorders, which can actually, upon isolating and finding the floater, can actually vaporize the floater or destroy it. And this laser is very safe for the eye. We've been using it for many decades to treat other conditions, as I mentioned, in the eye. And now it's been adapted in a way to be able to handle floaters. Now, how does it work? Well, what happens is, if you're a candidate for this, we will look at you with special lenses and isolate and find the floater that seems to be causing your problem or your symptom. And we will focus this laser with specially designed lenses to zero in on it and actually ablate it or vaporize it. It doesn't just break the floater up, it actually destroys it. Kind of think of Star Wars when the Death Star attacked a planet. It kind of just vaporized it. Now, there's really no complications associated with this laser. Occasionally there can be a small little bleed in the retina if you're working very close to the retina, but that disappears without time, and to date there's really been no significant complications associated with this new technology. Now, if you're interested in this procedure and you have the floaters, please go visit our website online or give us a call at the office so we can bring you on in and evaluate you for possible treatment.